Okay. Well, first of all, I want to thank you all for being here and for joining us. And thank you especially to Congresswoman Jayapal for making this happen. We've been talking about this for a little while, and I'm glad to see that we're here and making this a reality. I would say that maybe a few people would be surprised to see you and me on a Zoom on this topic, because they might say, what does this have to do with commerce? Oh, Mary Kay says she can't hear. Can you guys hear?
Yes.
All right, I'll keep going. But anyway, this is an important point I wanted to make. Some people may say, why? What's this have to do with commerce? And the reality is, this issue is an economic issue. In my own view, this should not be thought of as a liberal issue or a social service, because the reality is the lack of affordable childcare, the lack of affordable elder care affects everyone in America, and it is holding our economy back. I will say myself, I'm a mom of 2 teenagers. I care with my sister for our 90-year-old mom. And I've only been able to do that because of our care community. And as governor of Rhode Island, I did a lot actually working with Mary Kay Henry to make investments in our care economy. And I know it works because we saw it work. The fact is, we all know millions of women dropped out of the workforce during COVID. And the number one reason for that is because lack of affordable childcare. How do I know that? Because I run the Census Bureau, and the census data shows that that was the number one reason. And while the majority of college educated women have been able to return to the labor force, there are far too many women in industries like retail, hospitality, who are still struggling, haven't been able to get back into the workforce, or if they have, not in the way that they should be able to, not full-time or at the salary that they should be making. Millions of workers, particularly women of color, are still today sitting on the sidelines of our economy and sitting on the sidelines of industries that need their talent and are willing to pay for their talent. So I feel so strongly about this, and I have said to every business leader I talk to every member of Congress I talk to, we need a more vibrant care economy in the United States of America. We also need more integrated, highly effective job training programs. And we also need to do a better job of paying and supporting people in the care economy. The brutal reality is that these people who care for our parents and children, the most dignified, important work that there is. And in many cases, people are working full-time and in poverty. So I hope everyone on this call views the Commerce Department as a partner in this work. I would say, and I say this to myself regularly, let's not get discouraged. I wish we had passed this care economy stuff through Congress already, but just because we haven't, that's why we're here today. Let's continue to elevate the discussion. Let's continue to recognize that in the current labor shortage that we have in this economy, time is wasting and we have to get this done. So with that, I want to turn it over to the chair of the Congressional Progressive Caucus and an amazing legislator, Congressman Jayapal.
Secretary Raimondo, thank you so much. I remember that conversation we had, and you have followed through. And I remember you making that point so clearly that this is about the economy. This is about workers. This is absolutely essential to everyone's ability to really build a strong economy and strong families. So I deeply appreciate you doing this today. And of course, President Mary Kay Henry, you have been a shining star in the fight to really put forward exactly what this means to workers, what our care economy needs. So grateful to you, and of course to all of the workers who are on the call. And I do have to give a particular shout out to Joe Hufford, who I know is here from Seattle, my home city. So glad that you are here with us as well. I really think that there couldn't be a more essential time for this conversation. The economy has made a remarkable recovery thanks to the American Rescue Plan. And under President Biden, more than 8 million jobs have been created. We are on track right now to recover every job lost during COVID by the end of this year. Unemployment is down to 3.5%, the lowest since before the pandemic, and actually the lowest in over half a century. And let me just remind you, the American Rescue Plan was brought to the president's desk with every single Democrat, with only Democratic votes and without a single Republican vote. So these numbers are remarkable, and they show the power of investing directly in workers and working families, as the president often says, aiming to grow the economy from the bottom up and the middle out. But the truth is, we can't ride ARP's coattails forever. And if the recovery is going to continue, we do need to invest in the care economy. There are many economists and researchers who have noted the hit to our economy wasn't just a recession. It has also been characterized as a she-cession. During the pandemic, women workers accounted for more than 55% of jobs lost. And for women of color, that number was even worse. By late spring of 2020, unemployment among Black women was over 16% and Hispanic women at 20%. 1 million of the single mothers living below the poverty line lost their jobs. And while many of these jobs have been recovered, it just hasn't been at an even pace with men. Even by February of this year, men had regained 3 times as many jobs as women had. And when care workers are still deeply underpaid, returning to this work is not going to deliver the kind of economic security that's needed to support working families. So in my mind, it really comes down to this. If we want to strengthen our economy, we have to expand care options and we have to invest in care workers. We know that it isn't just about women, by the way, it's about parents, it's about families, it's about men, that parents with young children and all of these families have faced great challenges in reentering the workforce due to a lack of affordable care options. In my state of Washington, households already spend, on average, 14% of their income on childcare. And in Seattle, childcare costs an average of $2,400 a month per child, rivaling what it costs to go to college. And the racial disparities are stark. Childcare is least affordable for Black and Latino families with low incomes, for Asian Americans and Latino children who have particularly low access, levels of access to childcare subsidies. And of course, Native American and Latino communities are more likely to live in childcare deserts that push care even further out of reach. And when we zoom out to look at the state of the childcare workforce, the challenges are even greater. We know that virtually all childcare workers are women, and our society has been increasingly reliant on these unpaid caregivers, which is a burden that is primarily shouldered by women and disproportionately women of color. Even within this low-paying field, positions and wages are unequal. A 2019 study found that Black and Hispanic workers are more likely to be relegated to these lower level positions within childcare programs. And even if you account for education levels, Black early educators are typically paid 78 cents less per hour than their white peers. But I want to be clear that the challenges are not limited to childcare, an issue that of course resonates across the country for suburban moms, as well as for folks in rural areas or urban areas. The minimal care infrastructure that already exists in the United States has failed to provide a secure basis for a functioning and healthy society. And the pandemic has pushed an already fragile system to the brink of collapse. The costs of childcare combined with healthcare, combined with long-term services and supports, an area that we saw how desperately needed, if we didn't know already, how desperately needed those long-term services and supports are. We saw that during the pandemic. And this is really untenable for most people and families, and it's poorly covered by a patchwork of federal and state programs that simply are not giving children, older adults, people with disabilities, family caregivers, and all Americans what they need to be successful, that they need to wake up every morning and feel like their life and their opportunities are getting better. So there's no question to me that the path to a strong and resilient economy runs right through the center of the care economy. A study from the National Women's Law Center and the Center on Poverty and Social Policy found that investing in affordable, high-quality childcare for every family that needs it would increase the number of women with young children working full-time by 17%. This will bring monumental change for generations of women and help narrow the lifetime earnings gap between women and men. And I have to say, since I co-chaired the healthcare task force, the Biden-Sanders Unity Task Force, with President Henry on it, we prioritized this question of home and community-based care because we knew how important it was before COVID, certainly during COVID, and now after COVID. So this is our task, to invest in the care economy at the level that it deserves and to ensure that these investments are implemented with equity in mind. Let's make sure that we shift care work and care workers out of some invisibilized and undervalued place into actually being treated as central to our economy as they are. And let's provide every person in this country the basic human right of comprehensive care, which, by the way, they are in the business of providing to everybody else, and yet make sure that they also can live healthy, safe, and dignified lives. And by building coalitions like the one represented here today, with government, and labor, and workers all coming together in the service of this common vision and common good, I do believe we can get there, and I believe we must get there. So thank you so much, Secretary Raimondo, for being such an incredible champion on this issue, for continuing to fight for it, and to making it clear to everybody exactly why the Secretary of Commerce should be front and center of discussing the care economy's role in our overall economy. I'll turn it back to you.
Thank you, Pramila. That was awesome. And we're just going to stay at it until we get it done. It is now my pleasure to introduce a good friend and someone I've worked with for a long time, Mary Kay Henry, president of the SEIU, first woman to lead the union and co-founder of SEIU's Lavender Caucus. You need to get some more lavender clothes, Mary Kay, not just the purple. Which is the gay and lesbian group within the union dedicated to improving rights for LGBTQ folks within unions and at the workplace. So Mary Kay, would you please share a few remarks?
Of course. Thank you so much, Secretary Raimondo, and to our chairwoman, Pramila Jayapal, who leads the House Progressive Caucus and does so right by everybody in Seattle and the district that you represent. We are proud to join with you two who have been champions of why the care economy needs to be invested in and how we've had it with the exclusion of childcare workers and home care workers from basic rights and protections that are provided by the National Labor Relations Act, by Social Security, by the Fair Labor Standards Act. And we are going to right this historic wrong. Where women's work has been undervalued and women of color have been disproportionately impacted by this exclusionary policy. And that's why we're proud to honor you as champions. I'm also proud to honor the work that Mickey Jones Ray does every day on behalf of the 2 million other childcare providers and the 2 million home and community-based services providers. Mickey, we know that you are building the brains of the future generation of children that is going to be critical to this nation maintaining an economic growth and a shared prosperity that includes everybody for the first time in our nation's history. So thank you for the brains and grit and heart that you bring to the care work that you do every day. And to standing with Nath Lawver and Joe Hufford today in thinking about why this matters so much. We're grateful. And I just want to remind us, we are in the midst of a global pandemic that landed really hard on Black, Brown, immigrant, and Indigenous communities, both care providers and the families they serve. That Congresswoman Jayapal, you just outlined the data incredibly well. And that's why at this moment, post-pandemic, and as we enter the an investment is so critical in this work. And the other key ingredient to the investment that we think is really important and that I know Mickey can speak to is the ability of these women primarily to join together and bargain a better life through a union. And that becomes a permanent advocacy force in the economy for the investment in care, but also in making care work the foundation of the next all-inclusive American middle class, built in the last century by auto workers, but it's going to be built in this century by Black, brown, immigrant, and indigenous white women standing shoulder to shoulder and building an economy that works for all of us. So I want to thank you so much, Congresswoman Jayapal and Secretary Raimondo. I'm going to hand it back to you. We're proud to be a part of this.
Thank you, Mary Kay. Just to, I guess, emphasize that last point you said, as some of you know, prior to this job, I was the governor of Rhode Island, and we did what Mary Kay said. We organized and unionized childcare workers, home-based childcare workers. And I was able to sign a contract with them, and then a second contract, and which included pay raises and just basic employment rights, I would say. Healthcare, increased wages, providing computers. It dignified the work. It professionalized the work. And we took similar moves with home care providers. So for the elderly. So I guess I would just want to emphasize what you said, Mary Kay, which is that does work. And unionizing these people, women mostly, makes such a difference because, as the Congresswoman said, I think you used the word invisibilized. I've never heard that word before, but these are folks who live in the shadows. And one way to get them out of the shadows is unionize. And so I just wanted to really focus on that. Okay, so let's kick this open to our fantastic panelists. And I get to ask the first question to Nath. Thank you. Good morning, Nathan. Thank you for joining us. Nath's the Executive Secretary of the Pierce County Building and Construction Trades Council. And as everyone on this call knows, last year, Congress passed an infrastructure law on a bipartisan basis, which is, creating thousands of jobs, good union jobs all over the country, investing in infrastructure, including the high-speed broadband that the Commerce Department is responsible for implementing. Now, we're creating a lot of jobs. That's good news. The challenge is, and this, Nathan, I want to hear from you on this, if there isn't enough childcare, it's hard for you to recruit people and especially for you to recruit women and people of color. So maybe you could talk to us a little bit about how the lack of childcare or the lack of affordable childcare is affecting young workers coming into the building trades and your ability to get young apprentices, particularly women and people of color, into the building trades.
Thank you, Madam Secretary. Appreciate being here today. Representative Jayapal, it's good to see you. Finding adequate care given the hours and the cycles of the construction industry is terribly difficult. Our members find that the operating times for facilities and the contracts and location options just don't cut it to be able to have a family and go into the apprenticeship programs or to go to work. Many construction workers will commute, up to 100 miles or more on a regular basis to get to the work site. Here in the Puget Sound region, we have members that drive from Aberdeen to Seattle because that's where the work is. So to think of having work daycare centers and that be able to accommodate hours that start at 6 a.m. or earlier for those that do need to drive, and have some flexibilities for those folks that end up having to work well past 7. When we have emergency repair jobs or things like that, there's no time frame for that, and we need to have that flexibility. And then when we look at folks that are currently relying on different benefits and subsidies for child care here in our state, once they enter the apprenticeship program, rather quickly they hit those benefit cliffs that we call that they run out of the ability to have those subsidies, and then they have to make decisions of, do I continue with my apprenticeship program and kind of jury rig some sort of care for my children, or do we continue to put them in the quality care centers that we trust and that are provided on that? And some of our apprentices do stop because they're making too much money, and that's kind of a catch-22 for them. And so working really hard to see that those cliffs end up being more of a gradual slope for them as they go into their careers and are doing what we want them to do and doing what they want to do. They're passionate about getting out there and working and building a better community. We should be there with them to see to it that their most precious piece of their lives, their children or maybe their parents, are taken care of and taken care of well.
Thank you, Nath. That is such an important point. It does you no good to have a childcare center that opens at 8 if you have to be at work at 7. So it's something that we have to work on. Representative Jayapal?
Yeah, thank you. And Nath, you are, it's great to see you, by the way, and you're echoing when I went to visit the Washington State Convention Center, which is in the midst of being renovated. This is one of the things that the workers there were talking to me about, how challenging it is given the hours. So thank you for raising that. And by the way, I should just acknowledge that all 3 of our workers are from Washington State, if not the great city of Seattle. So thank you, Mickey, as well for being here and for representing our great state. Joe, I had a question for you. We've been talking about the changes of a pandemic economy and workforce, but there was certainly no industry that shouldered that burden more than our medical workers. And I was hoping you could just share a little bit about the impact on patient care and also on healthcare workers yourselves as you went through this pandemic and before, of the lack of affordable childcare.
Thank you, Congresswoman. Thanks for having me here. Nice to see everybody. I am a nurse here in Seattle, and my wife is also a nurse. So we were both nurses. We both work in community settings, visiting patients in the home, in homeless shelters and permanent supportive housing units, tent encampments and the like. So we, of course, were essential workers, had to continue to come to work. We thought we had childcare pretty well figured out because our grandparents were performing childcare primarily. We had a 1.5-year-old. What we did not take into account is that they'd get scared of their own grandson because of what their kids did for a living. So after the first 3 months, one of the grandparent groups decided they could no longer in good conscience care for their grandson because they were also caring for their elderly parent and didn't want to bring COVID from our grandson to their parent. A couple months later, our remaining grandparent dropped out for similar reasons. She had cancer, so didn't want to be caring for a kid who might bring her COVID. Our kid turned 2 at around the same time, so we were able to find part-time childcare. However, the childcare provider's roommate found out what we did for a living and had concerns that our childcare provider might bring home COVID to her based on our professions. She made a principled stance and continued to care for our kid part-time, which we're very grateful for and always will be. Through that time, due to the loss of childcare, we had to go from having 2 days off together a week to having 1 day off together a week to my wife having to work every weekend and us having 0 days off together. So our jobs got more and more stressful, less and less sense of security, and we lost the benefit of emotional support of each other, as well as the presence of our parents, for whom we historically have relied on for significant emotional support, as well as, of course, the nuts and bolts of childcare. Us changing our schedules had a significant impact, of course, on us and our families, but also on our patients. There's nobody to cover the days that we don't do our jobs. There's no coverage. There's no redundancy in the healthcare field anymore. Just as we're coming up against the limits of just-in-time manufacturing, we're coming up against the limits of that same sort of philosophy applied to the labor force in the healthcare industry. We need redundancy. We need extra people who can cover for nurses and other healthcare workers when we get sick. We're currently pregnant with a second kid, and we're not sure what we're gonna do when that second kid is born. You mentioned the average cost of Washington State childcare to be $2,400 per child. $2,400 is about one of our paychecks. We get 2 paychecks a month each. So once 2 paychecks are eaten up, you start asking yourself, why bother going to work? That doesn't make any sense. So I think the next time, when we have a kid, for the 2 years that they're both in childcare, one of us will stop being a healthcare worker. We'll stop working as a nurse because it makes more financial and emotional and just total well-being sense for one of us to just quit and come back to the industry at a later time. I have a friend who's a master's in public health. He only has 1 kid and has decided just yesterday he's going to quit his job doing pro bono paralegal stuff for prisoner rights in Washington State. He's going to stay home, and his wife's going to be the primary breadwinner. And so a lot of my friends are making similar decisions. These are all folks with at least bachelor's degrees, oftentimes master's degrees, who are just finding it to make more sense for them to stay home, take care of their 1 or 2 kids than to participate in the economy with the credentials and significant educations that they've obtained.
Joe, first of all, I'm sorry to hear about all of the really tough challenges that you and your family have had. And also congratulations on your second child. That's really fabulous news. And I just wish it wasn't so hard for people to be able to think about having a family. This is something we all, or many people want to be able to do. And you didn't mention the high cost of housing in Seattle, but you take the high cost of housing and add to it the high cost of childcare, and you really are not just thinking about potentially staying home, but I have, unfortunately, a lot of constituents who can't afford to live in Seattle anymore because of that. And we're losing people from the workforce, which of course is the thing that is so challenging here. So thank you for that. Let me turn it over to Mary Kay.
Thanks so much, Pramila and Joe. Your story makes my blood boil. And people call this moment the great resignation, where people don't want to work. And you just made crystal clear that the pressures on working parents are so severe that this choice between working full-time outside the home or caring for children inside the home are pulling more and more people out of the workforce. So I don't think of this as the great resignation. I think of this as the great reckoning. And that's why we're so lucky to have Secretary Raimondo and Congresswoman Jayapal as champions in the government, and making clear that it would be win-win-win to be able to get more parents the support they need so they can stay employed doing the work they love. You both are clearly missionaries because of the kind of healthcare you've chosen to do. So thank you so much. And now I'm going to turn to another hero, Mickey Jones-Ray. Tell us about the children that you care for, the challenges their family face, and why you think it's so important for caregivers to get this investment and to be able to form a union. Mickey. You're on mute, Mickey.
Good morning, and thank you for having me on your panel. It's ironic that we're talking about this disparity, because that's basically what I cater to. I cater to families, people of color, people that are low income. So all of my children are subsidized children. I don't have private pay. And what I've discovered is that you've got many families that fall through the cracks. They're not uneducated, very, very bright young women that just happen to be single parents, but they have to make a choice as to whether or not they're going to work in the workforce that they went to school for, or drop out in order to qualify for subsidy. The problem with the subsidy programs, you spoke about the American Rescue Act. There was a subsidy here at King County where 2 of my families were a part of, and they were lucky to get into that subsidy because they didn't qualify for state subsidy. However, that subsidy lasts until the end of this month. So what happens for the rest of their time here? You know what I'm saying? Hi, baby. So it's just one of these situations where their financial impact has an impact on my financial ability to survive. I can't afford to hire anyone because it just takes a lot of money to run an in-home childcare. A lot of people don't realize that, you know, I'm not a center and I don't have as many kids, but I still have to, I have to cater to these children. I have to provide for these children. And the whole purpose of an in-home childcare is to make them feel at home and to nurture their minds as well as their learning experience and all that. But you know, kids break things, you replace things. It's a vicious circle. But the disparities that I've been seeing, and I had one parent to pretty much break it down like this. She says, I don't know if I should quit my job so I can keep my child care, or you know, keep my job and don't know what to do. You know, I mean, it's a really bad position to be in. You know, you pay all this money to go to school, and you get your degrees and you take advantage of that education, but you can't pay for childcare. And like I said, I take all subsidies. So I take the very minimum payable, you know, in terms of what most people charge for this service. And so therefore I do struggle. If it weren't for my husband, there would be a lot of things that wouldn't get done around here. So, but it's a vicious circle when it comes to disparities and ability to pay for childcare from families, especially on subsidy.
Thank you so much, Mickey, for that really clear explanation of the predicament that both the parents are in and you as a family childcare provider. Thank you. And back to you, Congresswoman Jayapal.
Thank you. Yeah, Mickey, you really have highlighted the intersectionality of all of our lives. And I think actually every single one of you did. And so I guess the question I have for all three of you, Nath, Joe, and Mickey, is I want to, you know, this is sort of like a final question to you all. What is the one thing that you would like elected officials to know about the need to support and expand affordable childcare? Maybe Joe, will start with you and then go to Nath and then go to Mickey.
To me, it just seems like one of the most essential services that can exist in an economy. I mean, for a society to reproduce itself, there needs to be a certain number of parents, and quite a few of them actually. And if those parents are to be able to participate in the economy, they need somewhere to put their kids before kindergarten starts. So it just seems extremely basic to me, and I'm not sure why it's considered a luxury.
Thank you. Nath?
You know, as we go back to the job site and we go back to work, we need to think about the new construction workers and the new people getting into this economy, and we need to support them. I studied history in college, and one of the things I recall is during World War II, we subsidized daycare centers on site in the Puget Sound shipyards, right? And so women could participate in the workforce at that time, right? And so we've done it before. We can do it again, and we can do it better, and it's only going to benefit everybody. So I think it's just really important that just as we work hard and we expect dignity on the job site, and that we also want to make sure that the people taking care of our children while we're working are afforded that same dignity, respect in those care centers.
Thank you, Nath. Mickey?
I think that if anything, if the resources could be expanded to people that need childcare and lower the expectations of eligibility, I think that a lot more people would be able to get childcare, because if you're making too much money and you don't qualify for subsidy, you're put in a bad position to have to pay out of pocket. And the reason why people are applying for subsidy is because they can't afford childcare. So I think that the expectation of their eligibility should actually be lowered somewhat, because they're falling through the cracks in large amounts. If they can get childcare paid for, then I can be paid, and we'll all work out here. We'll all survive.
That's a super important point. It's why we were fighting to have no family pay more than 7% of their income on childcare. And it's also why I think we need to be careful if we're too slow to phase in based on level of income, because middle-class families, a teacher in Seattle, you heard Joe's story, they are, because our wages are higher in Seattle, because we passed a $15 minimum wage. Thank you, Seattle, for doing that. But the reality of that is that our wages are higher, which means if you use an average state threshold of 125% of poverty and you don't move it up, or even 250% of poverty, you're going to be pushing out a lot of the middle-class families that simply aren't able to match, because you're using statewide numbers instead of local. But anyway, Secretary, let me turn it back to you. And again, thank you so much for doing this.
Yeah, thank you. Well, first, we just have a couple minutes left. So number one, I want to thank each and every one of you for taking some time out of your day. I can see you're all at work doing this, so I appreciate you taking time out to do this. Secondly, everything you said just remotivates me to get back to work and figure out how we can get this done. Joe, I think you're right. It really is that simple. When you put it that way, you're right. You're exactly right. And again, as the business person working for the president, it makes so much common sense to me that this is what is necessary. I will say right now, all this talk about inflation, which people are struggling, so much of it is related to not enough people in the labor force. If we could have more people in the labor force, more labor supply, it would absolutely help the economy. But that isn't going to happen if people can't, if they're leaving their jobs in order to, have to stay home to take care of kids. So the most hard-nosed business person should be able to understand that these are basic, necessary investments to keep our economy going. That's my story, and I'm sticking to it. And I think we all need to until this gets done, because it's just that important. And I guess for you guys, you three, just hang in there. Congrats on the new baby. That's so exciting. It will be harder, but it will be better. And just stay strong and know that we're doing everything we know how to do to make this better. And you being with us today helps us to tell your story to more people, to educate them, so Congress does the right thing and get some of this stuff, or get some of these programs over the finish line. The other thing too is universal public pre-K. Every 3-year-old should be able to go to public school all day for free. So Joe said, until kids, I understand you need some place to have your children cared for between 0 and 3, but damn it, every kid should be able to go to school, 3 years old, public school. So thank you all for being here. I would like to ask Mary Kay to give your closing remarks, and then Congresswoman Jayapal to take us home and close us out.
Thank you so much, Secretary Raimondo. I think that we just heard the key points, which is Joe saying essential service in the economy. It's extremely basic. Quality, accessible, affordable childcare is a key lever to making a just and equitable recovery for every working person in this economy, especially Black, Brown, immigrant, and Indigenous parents and families. The second is, Nathan, I loved it. We've done it before. We can do it again as a nation. And what better time coming out of this pandemic that has been similar to a war on the front lines for all those essential workers. And then, Mickey, I think you've made the case that millions of early educators and family providers together in unions have advocated for hundreds of millions of dollars in states. But the federal investment that both Secretary Raimondo and Congresswoman Jayapal would make it even across every state for every family, and allow women primarily and parents to return to paid work outside of caregiving that they've had to prioritize in the way that Joe so powerfully described. And the ability of caregivers to join together in unions as a part of this federal investment is a key way to ensure that the investment continues year after year. So thank you so much for including us, and I'm proud to stand in solidarity with the panelists and with you, Secretary Raimondo and Congresswoman Jayapal.
Well, thank you all, really, Nath, Mickey, and Joe. I'm so proud that you're from Washington State. And just listening to each of you, I think, has made it crystal clear how personal this issue is, right? And what a collective issue it is. It is, when we think about this, you know, care workers they're helping to raise our kids and look after our parents and tending to some of our closest people and supporting us during some of the most challenging times in our lives. And it is on us to make sure that both the families are taken care of, but the workers who are supporting those families are taken care of. And so I'm really grateful to you for sharing your stories, because I really believe that, as Mary Kay knows, I'm an organizer too. That's my history. And I really believe that it's movements that make things happen. And I'm proud to be the chair of the Congressional Progressive Caucus, where we fought hard, as Gina knows, as Secretary Raimondo knows, for the president's agenda. This is the president's agenda: universal pre-K, universal childcare, home and community-based care. This is a president who understands what it is that families need. And so it was really my honor to be at the front lines of that with the Congressional Progressive Caucus in getting these things across the finish line. And let's just remember, we got 99% of Democrats in Congress ready to vote for this package. You know, we got slim margins. What can I say about that? We gotta get something across the finish line, and it's going to require 51 votes in the Senate and 218 in the House. I promise you, we are not going to stop fighting for this. And let me just tell you, I came back from Germany recently, and I met with the ruling government there, coalition, as well as members of parliament and others. And they passed a 12 euro minimum wage, national minimum wage, the day I was there. And that's about $15 an hour. And then we started talking about the fact that they provide universal childcare, they provide universal pre-K, they provide healthcare. So you start taking all those things off of our $15 an hour, and you know, pretty quickly you're down to some pretty bare tax. So we are not going to let anything stop us. We are powered by a movement of people fighting for collective bargaining rights, fighting for the right for workers to make decisions about their own lives and their jobs and have workplace democracy. And of course, fighting to make sure that every family in America has the opportunity to raise their children with dignity, with justice for all. So thank you, Mary Kay Henry, for your incredible leadership. And Secretary Raimondo, you're amazing. Thank you for making this happen today. We really appreciate it. And of course, for all the leadership you're showing for our country.
Have a great day, everybody. Thank you so much.